The first thing I did was introduce myself to my patient and I identify her using two identifiers, name and birthday, then the other medical records according to agency policy.
Good afternoon, Ma'am Kimberly. I'm your nurse for today, Joanne Leslie Lasa. So I'm going to perform the procedure together with my patient.
Evaluating vision. Test distant visual acuity, position the client 20 feet from the Snellen or E-chart and ask her to read each line until she cannot decipher the letters or their direction.
F, T, T, O, Z, L, P, E, D, P, E, C, F, D, E, E, F, C, D,
Test near visual acuity. Performing confrontation test to assess visual fields. Perform corneal light reflex test. This test assesses parallel alignment of the eyes. Perform cover test. The cover test detects deviation in alignment or strength and slight deviations in eye movement by interrupting the fusion reflex that normally keeps the eyes parallel. Perform the cardinal fields of gaze test, which assesses eye muscle strength and cranial nerve function. Inspect the eyelids and eyelashes. Note width and position of palpebral fissures. Assess ability of eyelids to close. The upper and lower lids close easily and meet completely when closed. Observe the position and alignment of the eyeball in the eye socket. Eyeballs are symmetrically aligned in sockets without protruding or sinking. Then inspect the bulbar conjunctiva and sclera. Then inspect the palpebral conjunctiva. Evert the upper eyelid. Ask the client to look down with his or her eyes slightly open. Gently grasp the client's upper eyelashes and pull lid downward. Place a cotton tip applicator approximately 1 cm above the eyelid margin and push down with the applicator while still holding the eyelashes. Inspect the lacrimal apparatus. Assess the areas over the lacrimal glands or lateral aspect of upper eyelid and the puncta or medial aspect of lower eyelid. Palpate the lacrimal apparatus. Put on disposable gloves to palpate the nasolacrimal duct to assess for blockage. Inspect the cornea and lens. Shine a light from the side of the eye for an oblique view. Look through the pupil to inspect the lens. Test for direct response by darkening the room and asking the client to focus on a distant object. Test accommodation of pupils. Accommodation occurs when the client moves his or her focus of vision from a distant point to a near object, causing the pupils to constrict.